So today I'm going to tell you exactly what I do, because it's simple and it's something that really any of you can do. So at Restore, we follow the Restore Method. Probably could guess that one, right? The idea is there's some treatments you do on a daily basis, some that you do on a monthly basis, some that you do on a quarterly basis, and some that you do on a yearly basis. And I'll tell you exactly what I do. And for starters, I am 40 years old, just for the record, not wearing any makeup. This is me, this is what I've got, right? So on a daily basis, I use a Restore Renewal Cream that we actually compound here. It's a retin A, a vitamin C, and a bunch of alpha hydroxy acids that's really just to stimulate collagen production in the skin, exfoliate your skin, give you a glow, make your skin look healthy and strong. I mean, look healthy and strong, but be healthy and strong. I also use a lactic acid cleanser because I have very sensitive kind of rosacea-y type skin. And of course, a zinc-based sunscreen. Everybody has to wear a zinc-based sunscreen at all time. We live in Colorado, ladies. We're at 5,000 feet. You gotta protect your skin. It's an investment, right? Then coming up to the monthly treatments, these are the things that you do for your skin to maintain your skin's health in the office. So for me, I do a couple different things. I do microneedling. I'll do about 3 or 4 of those a year, depending a little bit on sort of where my skin is and how much damage I've been absorbing. But the idea with microneedling is it's going to rebuild that collagen, shrink those fine lines down, shrink those pores down, and make your skin really healthy. My personal rule, I have this little line right on my lip. I only have one. And every time that line comes back, it's like, oh, I need a microneedling treatment. I microneedle, it goes away. And as long as I'm doing the microneedling on a regular basis, all those little tiny fine lines, they're taken care of. So that's really nice. The other thing that I do for my skin is I do have some rosacea, so my skin has a lot of red undertones. I use the Genesis laser, same thing, a couple times a year. IPO about once every 18 months to drive down those reds and kind of keep that stuff under control. And as far as in-spa treatments for my skin, that's it. Microneedling to chase down those fine lines, Genesis laser and IPL lasers to control the reds under my skin, which is not a problem everyone has, but that's for my skin, that's what I do. Then when it comes to the quarterly, that's your Botox. So obviously, take everything I say with a grain of salt, but Botox is fabulous. I use it pretty much everywhere that it can be used. I Botox in between my brows here, across my forehead for those horizontal lines, around the corners of the eyes for the crow's feet. I do my nose because I have these like really strong bunny lines. Just genetic, what are you going to do? I do my nose. I also do a little bit in my neck because I get those like bands in my neck when, from pulling on those muscles. So I do my neck as well. Altogether, I use 63 units of Botox every about 4 months. I'm a little bit longer responder than some people, but that's just luck of the draw. Some people are 3 months, some people are 4 months. I fall in the 4 months. But Botox, pretty much everything from here to here, as much as I can, as often as I can. And then the last piece of the Restore Method is the yearly treatments, and that's your filler, right? So Botox takes care of the lines from expression, the lines from muscle contraction, but you're also going to need to do something to replace the structural support that we lose all across our midface as we get older that makes our skin go, oh, right? So I've got 1 syringe of filler in each cheekbone that kind of gives me a little bit of a up and back kind of lift, which is a really nice little look. I also have 1 syringe in my lips and in the corners of my mouth. And again, without filler, I just have these little tiny rabbit lips, so I like to do my lips. You don't have to look done to have your lips done. They can be very small. They can be very naturally proportioned to your face. They don't have to be overblown. And that's what I do. I do a little filler here, Botox once every 3 to 4 months. I do some microneedling and some Genesis laser, some IPL to maintain the skin tone and quality and texture. And then I use a quality retin A, vitamin C, and sunscreen at home. And that's all that needs to be done. So come into Restore, get your care plan, get on it, look fabulous.